with our guiding session today, a Q&A question about coming to Australia, and if you have any questions regarding the ADC exam. So we'll just wait a couple of minutes, let more people jump in, and we'll see if there's any candidates have any questions or anything we want to go ahead with and explain in detail. I generally have over 100 videos on my channel now. When I started in 2019, it was all about, the aim was to at least put 100 videos to help maximum people out. And I'm so glad and proud at the same time that, I got to a point where I got the 100 videos on the channel. Now we have explanatory videos, we have informatory videos, we have educational videos, all on the channel, over 100 plus videos and the other reels that I post as well. So the channel has abundance of information about frequently asked questions about coming to Australia and all those aspects, about the courses I teach, about the tips and tricks session, about helping you for the ADC journey and ADC exams. So generally when people message me, we need some help coming to Australia, I generally just send them a one-liner, refer to my YouTube, because my schedule is extremely busy as well. And it's very difficult at that point to, talk to everyone in person. And that's why I was like, maybe these sessions going to be helpful for people to ask more questions. At the same time, for people to go back and reflect on the YouTube. I will see if I have so we're just waiting for some more people to join in and see if they have more questions or any questions that they want me to explain in detail. As I said, I have over 100 videos on my YouTube, so you have a lot of information for everyone to join in and everybody to, get the information they're looking for coming to Australia. I have detailed video on part 1, a detailed video on coming to Australia, detailed video on how to apply for permanent residency. If you want to apply for a dental assistant job, what are the best ways and how to apply and all those things. So I will start. So Alina has already messaged. That's great. So I will start answering questions one by one, and we'll go with that. And by the time we finish, I think that would be great for the session. So let's just go back. And so Alina asks, sir, I'm coming there for MPH. Meanwhile, how can I prepare for the ADC? So Alina, it's a good question. And I think majority of the time, planning is very essential. Even when we do a case, when we plan it right, the end result is amazing as well. We're happy with the end result. The patient's happy, everyone's happy. At the same time, when you're planning your future, you're coming to Australia, you should plan everything correctly. Now, the first thing, what we need to know about this, Alina, is MPH your main goal? Is settling in Australia your main goal, or MPH is plan B, and coming to Australia and working here as a dentist, that's your priority number 1? Because I know a lot of people, they say that ADC is my main goal, but for the time being, I will get admission in MPH. So I'll get those 4 or 5 years, and by that time, I will work on doing my ADC as well. So if that is you're thinking as well, that you need those 4 or 5 years, and then till that time you want to pass your ADC while doing the MPH, then definitely good. So then now we got the second question, which is good. So let's just stick with Alina's question, and then I'm gonna start answering one by one. So what I would personally suggest, Alina, that you should, before you come to Australia, if you have time, do research for the whole topic. I have a detailed video on how to start preparing for your part 1. Do that. Do more research on the books and everything. I would say before you come to Australia, you should learn everything about part one. Do your research, do your studies, because when you come to Australia, you will be working as well. Obviously, you need some part-time job to get that money as well and sort out your finances, pay for your food, pay for your expenses, pay for your rent, all those aspects while doing the masters in public health. So it's not easy, right? And then you want to study for ADC as well. Now, a lot of people, when they come to Australia, then they start studying for the ADC exams. Now they're really difficult because they're working part time and they're doing the public health as well. And then they say it's very difficult to do three things at the same time. It's not easy. I did the same way as well. I did a lot of planning prior coming to Australia. I already studied majority of this study that I need to do for the part one exam. So I did that, and I would advise the same for you as well. I would say do all the research, do all the study material, do all your homework first before coming to Australia. So you're already mentally comfortable that you have done all the study that you need to be done for part one. So when you come here, you're reviewing all the material, you're getting new information, and then you're reviewing the material, and your journey has begun, if it makes sense. And then when you come here, you just apply for the initial assessment, you get another 6 months, you possibly try to get a dental assistant job if you can. That would be I would highly recommend that. That would really help you getting into the dental industry as well, learning from the start how things work. And I have a detailed video on how to apply for dental assistant job and what they look for and what are the best means of applying. You should put those things in your resume, apply like that, and there'll be high chance. So I would say before you come, work on your part one. Start studying already. Make sure that you already have studied for the part one exam before coming to the dental exam. And that what I would suggest would be the best thing you can do. Okay? If you want some additions on that answer, you can type again, and I am more than happy to include anything that I've missed. Okay. So meanwhile, how can I prepare for ADC? Yeah, just start studying for the part one. All the books are available online. I have a detailed video on part one, as I said. Work on those books, start studying already, look at the cases, look at planning the cases, and trying to have a holistic approach. So you're not treating just one tooth and that as a whole person. And that would really help get everything organized for you for your ADC exams. Because now, if you see even the part one exams, they're trying to get more of the questions which are scenario based, not just like someone has rectified it and learned everything and memorized everything. Second question is from Mubashir, and he's saying, can I buy a setup from Pakistan or anywhere else? Is it cheaper? Doesn't matter. I know people who have passed the exam just by buying that a model, not even a mannequin head. So get whatever you can on an initial basis, any stand and the teeth, so you can start prepping the work, especially for part two. But for part one, mostly you will need the science behind it. So you need a bit more theoretical at the same time, combining those theoretical and practical skills. So you're giving or learning more information on how things are working with a practical approach rather than just one-liners. Because when you look at a scenario-based question, it's like dealing a whole patient. Someone comes in, how will you examine them? How will you assess them? What are the clinical things you're looking at? How will you diagnose? How will you manage? So it's like a whole patient. And that's why Odell's Clinical is a very good book for your training, and you should look at all the scenario based questions and then go back to your other books and looking at the other things as well as therapeutic guidelines, which also gives you all the information. So mixing a couple of books really helps. But I would say if you're looking for any mannequin, if you feel like you can get a cheaper one from India or Pakistan, just get it. Doesn't matter. At the end of the day, it doesn't matter. A lot of people, I think, are always worried about, should I get this? Should I get that? or I need to get exactly the same instrument that comes in the ADC. Even if you can't get it, it's all about improving your skills and showing them your knowledge. Even if you get a different teeth and you haven't practiced, if your hand skill is good, you'll be comfortable doing it any other tooth as well. So it should be okay. Doesn't really matter. So if you get something cheaper, get it. Normally, Nevada Dental in India, I think, gives you similar stuff that you get in ADC, and that's comparatively a lot cheaper than getting the Australian version. Yeah, that would be the best thing that you should go, and I did as well. Nevada Dental. I've mentioned in detail in my part one video as well. But if you're looking to buy anything, eBay or Nevada would be something that you should look for. Would be a lot more easier for you because budget is our main priority. Now, a lot of people asked me about budget as well last time. I have a detailed video on budget of the whole ADC process from start to finish. How much budget are you looking for? So that is something that you can go and watch as well. I have a detailed video on that. Let's look at other question. I think it was the other question was also from Mubashir. Dental assistant pay scale, is it similar or to an odd job? It's similar to an odd job. A dental assistant, as I said, I think I've mentioned in detail about my dental assistant video as well. Mubashir, I would highly recommend go and watch those two videos. That's going to be really helpful for you to get a detailed idea. Any odd job can start from $12, $13, but it really depends on the age of the person as well. Most of the people, like all of us, are coming as a dentist, so we are mostly over 25 plus. 24, 25 plus, you have to give them at least a minimum wage of, I think, $16 or something. So generally, until you're doing cash, which I don't think is legal, but a lot of people still do it. So it's mostly, I think, $16 plus. So generally with dental assistant, they pay you somewhere between $18, $20 an hour. It goes up to $35, $40, even $45. Really depends on where you work. Are you working for a dental specialist? Are you working for a general dentist? Are you working for a busy practice? What sort of duties and roles you get? Are you just holding the section? Or are you taking photos as well for the clinician? Are you writing their notes? Are you doing other stuff for them as well? So all those things included. So yeah, I think dental assistant, go and watch my full video and that would be really, really helpful for you. Next question is from Mohammed Hamza. Thank you for your time, sir. My pleasure. I think that's something it's good to give back as well. So I totally believe in that. What is the job and PR situation in Australia for dentists? See, whether you're dentist or non-dentist, jobs are available for everyone. Yes, it's difficult or not very easy for people when you don't have a permanent residency and citizenship to get really high-end jobs. But when it comes to odd jobs, we're talking about Uber, driving an Uber or Uber Eats, the Uber delivery, or we're looking at working at a petrol station, pizza delivery, working as a food server. There's so many odd jobs available. You just name it, right? Working at a gas station already, I think named it. A kitchen hand assistant, working as a wait person, working as a cleaner, working, as a dishwasher. There's so many jobs available, like a pizza delivery driver, delivery drivers. There's so many jobs available. Any job out there, and you will hear people saying it's difficult. Nothing comes easy, right? Nothing comes for free. Nothing comes easy. However, it is possible. I did them as well. Majority of the people come to Australia do them as well. So initially, you want the money. So you will get whatever jobs available. You'll apply everywhere. But your main focus should be more on the dental assistant jobs. Apply with the tips and tricks that I've mentioned, how to apply for your dental assistant in my video. That would be really helpful for people to get the jobs. But most of the jobs, the odd job situation is, jobs are available. You just have to apply. Might not be easy. Maybe after the 10th or 15 or 20 attempts, you might get one, or you might get even, you have to apply more areas. It also depends which city of Australia you're living in as well. Like Sydney, Melbourne have more jobs opportunities. Other areas have less. But I have generally seen it's all about your efforts and how much hard work that you put in. Otherwise, most of the people I know, they got the job. Initial months are a bit of a struggle, but sooner or later you basically get it, and it works like well. PR situation. When I came to Australia in 2015, January, I still remember I came here and everybody told me that PR is not possible. And I was like, I told them, yeah, that's fine. With time, I will figure out something. It's never easy for anyone. If it's not easy for me as well, it's not easy for the people who have come after me or before me. It's never easy for anyone. However, things change. The areas where you need to look into is do the work, pick a master's that's in the skilled occupation list, ideally, if not at least in the consolidated skilled occupation list. That means you can either work in a regional or you're in the skill list as a backup. So if your dental is not happening, at least you get PR with the help of your master's. A lot of times people really demotivate you and tell you that it's impossible. It's not impossible. There are a lot of ways. You just have to sit down with the lawyers. I have mentioned in my PR video about my lawyer details as well. You can have a consult with him, have a detailed discussion about your pathway, how you can get your PR. But one thing I will definitely say, there are a lot of pathways available. Yes, it's difficult. With time, it's getting more difficult. It's not getting easier with getting PR. However, there's always a possibility. There is a possibility. So when people tell you that, PR in Australia is impossible, just tell them, don't believe in them, I would say. Because I got it. I'm a citizen now. So people told me and demotivated me a lot as well, saying that, you won't get your PR. But I just stopped listening to people. There are ways that you could go to a regional area, work and everything. So if there is always this thing in your mind that if I do my ADC, will I get PR? Yes, you will get PR. So don't need to worry about that. If someone can pass the ADC exam, they will get PR. Tell me one dentist who went through all this process, passed the ADC exam and sitting in Pakistan. They're not, right? They are working, or they're sitting in India, or they're sitting in their home country. Most of them, not even most of them, 100% ratio, they all are here working. That means they've got the PR, right? So people will demotivate you. Don't listen to them. Just keep on working on your journey and you should be able to get the PR. Not easy. We might get a temporary visa, might get a different visa, but with time you start to get the idea on how to go on a bridging visa, on a temporary visa, and you sit down with the lawyers and you get a pathway based on your current position or that point in time, what your current position is, to get you something to stay here. Other questions I'm getting is, that's from Fahim. Sir, I'm in 30 BDS. What's your suggestion? Should I start preparing means regarding clinical cases? Book also helps in BDS curriculum as well. See, Fahim, again, very good question. The thing what we need to understand is they're not asking us anything new. They're asking us the same BDS, what we have studied, right? The problem is in the dental universities, again, it's different for everyone, but we have not got the knowledge that we go and see a patient as a whole. When we finish the BDS, our mind is trained in a way that we finish BDS, then we'll start studying. But ideally, you should study the BDS so nicely, you study it so well that your mind is so open already that, this is what you need to go and do. The problem is if you're already thinking that, first I finish my BDS, then I will go and think about abroad, you're not studying in a way. You may be passing exams and, finishing your BDS, but maybe you're not conceptualizing your learning. When we say conceptualize everything, that means you need to start seeing yourself as a clinician. And when you do your learning in your third year, your fourth year, and your final year, try to get the knowledge. Try to go for the knowledge rather than just passing. Because that knowledge, that understanding that you will develop, that's going to help you far. And that's what happens, that you go and you come here to Australia and now you start for studying for the Australian Dental Council exam, and then you'll worry that, oh, this is difficult. This is not difficult. Ideally, we should know this by your fourth year final year anyways. And then house job, you're reviewing all your techniques. They are not asking you anything new. But the problem is, majority of the time, we're not trained in a way. They're not taught us clearly about how to do a crown preparation or how to do an excess opening. Like I had the privilege and I had the honor to, and I'm grateful for that opportunity to teach specialists now as well. It's like half of my students are like specialists, 20 years experience, 35 years experience, 25 years experience, 20 years experience. They're prosthodontist to periodontist to oral max to endodontist, you name it. And sometimes even I'm like, okay, they're so experienced, but that's exactly what they say to me, that I've been doing endo for over 20 years, but this type of excess opening I never did. Because you need to understand it's a theoretical based clinical approach. You need your theory and science and then put it into practical practice. And yes, I do understand that, experience is important. It comes with time, but they're not treating you like a 20 years old clinician. They're treating you in the same way as they treat the young dentist who graduates from an Australian university. So things they're asking are on the basic level, fourth year, final year students level, and they want to judge you based on, if you pass ADC exam, can you go and see a patient tomorrow? Because previously what was happening was people were passing the exam, then they go and sit in the clinic tomorrow and they can't see anything. They can't see a patient, they cannot diagnose a patient, they cannot manage a patient, they cannot do a crown prep, they cannot take a clean impression, and then they are struggling. So that's the problem. If you in your second year planning to come to Australia or UK or Canada, most of the exams have similar practical approach. Some let you do the DDS like American and Canadian board, but UK and Australia, even the Canadian board have changed now to the Australian standard. So they want to test your practical skills, saying that you know it. In terms of the theory as well, like your scenario skills, how you're managing and diagnosing a patient. At the same time, how will you able to treat a patient tomorrow? If they let you do a small class 4 filling or class 2 filling, can you actually do a composite tomorrow or no? If you cannot do it, that means you're not ready to sit in the exam tomorrow. So when you go back to university again on Monday, your mind should be that, yes, I want to learn, but I want to become more knowledgeable. I want to understand everything that I'm learning, not just going through my 5 years, but making sure I have everything getting, renewed at the same time, you're feeding things in your brain that, you're getting that understanding of the knowledge. That's going to help you long term, and then put that into your practical skills. So planning again would be a good thing for you. Now we have another one which has, I've heard Mubashir's question again. I've heard we have maximum of 3 trials to pass ADC, or we could keep giving. See, the thing, what they have changed the pattern now. Previously, and again, if I'm talking about the theory first, your theory is valid for 3 years. In the 3 years, you can give 2 attempts every year. So for example, you have 6 attempts. After, if you couldn't pass, then your theory is going to expire, and then you have to go through the initial assessment process again, and you have to do the theory again. Now, if you have passed the theory and you're looking at the practical exam, then again you have 3 years. In the practical exam, if you gave 1 attempt every year, and second year you got 2 attempts, and the third year you got 1 attempt, but you couldn't pass, and it's 3 years are done now. Now it's expired, and you have to go through the theory all over again. You get your registration and you start the ADC all over again. So 3 years for theory, 3 years for practical. So technically, in a way, yes, you have 3 years for theory, 3 years for practical. So technically 6 years. Then we have a question from as a beginner, where should I start for part one? I would suggest go and watch my part one video. It's a detailed video, 50 plus minutes video. I've explained exactly how you should start, how you should look into it. Okay, so I would suggest, Alina, go and watch that video. That would be really helpful for you. And then we have Dr. Kabita. Do we get job in some regional areas in Australia if we clear the DHA exam? Now, Kabita, if I'm not wrong, and you can message and correct me, the DHA exam is your UAE exam, like the Saudi and the Dubai and all that, right? If you're coming to Australia, even if you work in a regional area, that means you have to pass the Australian Dental Council exam. Anytime someone tells me that I have 30 years experience or I've done this exam, that exam, does not count. You have to pass the Australian Dental Council exam. The only difference is for people who are DDS or they have done it from the UK. Not their exams, but they have graduated from a UK-based university or American-based university. For them, Australia allows them to come work here for 3 years, but within that 2 or 3 years, I think, and within those 2-3 years, they have to still pass the ADC exams to be able to keep working as a dentist. Otherwise, they have to go back. So whether you are a specialist with 30 years experience or no experience, you still need to do the Australian Dental Council exam. Without that, you cannot work in Australia. Either it's a regional area, either anywhere else. Anywhere in Australia, even if it's a small area, even in New Zealand, you have to do the ADC exams. Another question I get a lot is, if I pass the Australian Dental Council exam, can I still work in New Zealand? Yes, you can. Australia and New Zealand, they have a bit of a agreement together. So Australian graduates or ADC people, they can get the NATA thing done and they can work in New Zealand. Same thing is for New Zealand people as well, that they can work in Australia. So it's pretty much same standard and everything. Then we have Tejas. Hello, Max, sir. I went through the majority of the videos and they're really helpful. I want to ask you if we can bring our instruments there for home setup practice or not. First of all, thank you, Tejas. I appreciate it. I'm glad it's helping more people. I think that was the main reason of the YouTube channel. So I'm glad to hear that. Or do we have to buy all the stuff once we land there? No, Tejas. If you have your main bag, if you have bought the instruments, just put it in the bag. And just have a list of with you at the airport. And make sure you have something for the Australian Dental Council information and your information that you're a dentist. So even at the airport, they stop you and say, what are you taking the instruments? Tell them I'm a dentist. I'm studying for the Australian Dental Council exam. This is the exam I plan to pursue in the future. And that's the main reason I'm going to Australia while I'm doing my master's or just for that. So that's why I have that. Majority of the time, they don't check. So you can put in the bag all the instruments you have. However, make sure you're not putting a compressor or something. So anything that has air pressure that can blast off. So any like normal instruments, yes, a lot of people I know, my students, they do bring it from India, Pakistan, from Bangladesh. So it's not an issue, from Brazil even. So you can bring your instruments, but just to make sure that, you know, you're being mindful of what you're putting in the bag, and then you have a list. So if someone stops, you can just basically justify them. I'm not taking anything illegal. This is for my study material and I'm going through the Australian Dental Council exams. So that's what I'm basically doing. And then we have, so Tejas' question I've answered as well. And then we have, I've answered the PA scale. I've answered Alina's question as well. Then we have Hamad Said. Hamad Sayed, hello sir, can we sponsor the visa for our parents if we clear the part 2? How much tentative time is required? See, the visa process, again, it's different. It keeps changes from time to time. So the thing with that is that once you pass your ADC exam, you can always apply a sponsored visa for them for a visit. They get up to 3 months the first time, and then they can go back, and then the second time you apply, they generally get a multiple visa for up to 1 year or 2 years. So they can keep going back and forth, but they can come and stay with you first time for 3 months, then up to 6 months. Then they have to leave Australia and come back, but you can bring your parents, and after the couple of times, then you can look into applying at the PR situation. But it keeps changing from time to time, so it's best to contact an immigration lawyer who's going to be the best advisable for you. Then we have Status House. Okay, that's that's a different name. I would not expect that for your human name, but that's okay. Status House 777. Please tell me how difficult is ADC exam. M from India. See, as I said, nothing is easy. Even getting a job is difficult, right? So it's not easy. Nothing is easy. However, if you work hard for it, and if you do all the efforts that you put in to pass the exam, it might take you 2 years, might take you 3 years, might take you 7 years. I have a student who recently passed. He did it in 11 years. So everyone's different. So it's hard for me to say how much time it's going to take you. Somewhere between 2 years to 10 years, 2 years to 6 years. Everyone is different. Everyone's journey is different. Everybody's knowledge is different. Everybody's skills are different. So it's not one size fits all. Like if I'm wearing a medium shirt right now, half of you won't fit in the medium, right? So that's just why at the same time, everyone's different. So you can pass and you will pass. That's something I can assure you. If you don't give up and you keep trying, it might be your first attempt, might be your second attempt, but you will pass if you have studied well, if you have the right guidance. For part one, I always say you can study by yourself as well. However, if you can afford a course, why not get the right help and do it? I generally don't teach part one because I did part one without doing any courses. Part two, however, I feel it's very challenging, it's very difficult. So you need some kind of course for that. I have a detailed online course as well. I started that during COVID because previously I was doing the on-site sessions and on-site courses. With my online course, now people are getting help and passing the exam from all around the world. So that is the course that everybody can benefit from. Details are mostly in my bio. It's in my Instagram bio as well, my website link. You can look at the details. You can look into that course in the future if someone's interested. But generally, part two, you need some kind of course. Part one, you can do with or without a course, depends on how you're going with it. But that's generally, everyone's different. So it's hard for me to say how many months are enough. Everyone's different. So it might take you somewhere between 3 to 9 months. For some people, it take up to 12 months if you've studied the right way. And for part two, again, you need somewhere between 6 to 12 months, depends on your hand skills and your communication skills and how good you understand everything. So you're looking at, say, about 12 to 15 months for part two if you do it right way, maybe in the first attempt. Or for part two, again, you're looking for at least 6 to 9 months. Studying the right way, that means I'm saying 6 to 7 hours a day. Now, if someone says I can't give 9 hours a day or 6 hours a day, then you're looking at 3 hours or 4 hours a day. Then from 6 to 9 months, you might go for 12 to 15 months because you need the time to study, right? There's no shortcuts in that. Then I think I'm getting more and more questions now, which is good. So Mubashir again is asking us, after watching your videos on endo cases, I've realized it's quite different from the practice we do in the clinic. Similar situation goes for crown prep. So taking courses for part two is essential. Yes, Mubashir. I have 2 endodontists that I teach. One is from Dubai, the other one is from Pakistan actually. And they told me that after 15 years of practicing, when they did my course, they were like, this is completely different to what I was doing in the practice. And that's why I keep telling everyone that if there's a clinician who has 30 years experience, but if they were doing something differently or not with a theoretical based practical approach, then their concept might not help you for the ADC exams. So whenever you get a dental assistant job, look for someone who does the teaching, who does more courses, for someone who follows the clinical science with the theoretical based approach and put it into the practical approach, not just practical. Because I've seen people doing crown preps like just round it off and make sure the bite is okay. That's it. But the way we start teaching crown preps, people get amazed at how different it is. So Yes, majority of the time, I think we are not taught in that way. But when you actually open any textbook, all that is already written in there. That's how we should be doing that in the first place. So coming back to the person who was asking me, I'm a third year student, then ideally when you're doing your fourth year, final year house job, it's your job to read your textbook, answer questions from your clinician and people who are training you that this is what the textbook says. I was the only person in my batch, even in 2013, when I was doing my house job clinical training. 2013 and 14 was the years I did. And I was the only person in my batch because I wanted to. I bought a rubber dam from eBay, and I actually was using rubber dam in my endos as well, even at that point when nobody else was using. So I personally feel it's on you as well. If you actually go in and do the effort, you should be able to learn a lot of skills and challenge your clinicians who are teaching you that this is what I've seen in the book. Can you please explain me? So I've not done complex amalgam fillings in clinics, so practicing on models isn't going to be enough. Yes, practicing on models is going to be enough because even in the exam, they give you on a model. Because in Australia, they can't let you treat on patients, right? So all the exam is done on models, on the mannequin heads and on the teeth. So if you're practicing on teeth all the time and that's what you get in the exam, you should be able to nail the exam without a problem. Then we have, do you need loops for the ADC exam or is it optional? I would highly recommend getting loops, especially when we're looking at the grading criteria. There's so much minor details they need to look into. And I personally feel after using loops for over 5 years now, you cannot see it without loops. I personally feel you miss so much without loops. Now, after using loops, if someone tells me go and see a patient tomorrow, or even if I have teaching sessions, if I don't have loops, I will cancel that teaching session. I will just teach a communication and scenario-based practical training on that day. I will not do it. So loops would be really important. Now, the point is that a lot of people say loops are expensive and everything. You're going to spend a lot on the exam, right? So loops is a necessity, I would say. You have to get it. You don't have to get really expensive ones. Majority of my friends, they bought eBay loops for $20 or $30. You can pass the exam through the eBay loops. I know so many people who have passed it. And then when you say $30, you might feel, oh, $30 is a lot. But when you're coming to Australia, your hourly rate might be $30 or $25. So you can easily get an eBay loops if you're coming to Australia. And then your light would be another $10, $15. So light is very essential with the loops. Whatever you see is what you produce. If you cannot see anything, you may not be able to see your mistakes as well. And then you may not be able to verify or check your work and learn from it. So yes, in my personal opinion, loops are very essential. All my students know this. If someone says no loops, I'll be like, no training from me. Maybe you can get a training from another clinician, but that's very important. And then we have Karen. Karen is saying, hello, Dr. Murtaza. Hey, Karen. Any suggestions for dental hygienists? AD exam part 1 is your online course suitable for dental hygienists too. Thank you for your amazing videos. They're very motivating. Thank you, Karen. Appreciate that. Karen, dental hygiene exam is different to the ADC part 1 exam. ADC part 1 exam, they asking you a lot more. However, the hygiene exam is not asking you on the same level for dentists. For hygienists, they're asking you basic skills. I did go through once because a lot of people in the past have reached out to me about the dental hygiene exams as well, if I can help them. They're asking about basic knowledge, about, the basic techniques, some rubber dam stuff, some basic restoration. Again, it'd be more focused on kids dentistry and things as well. So your basic elements, you don't need to work on, endo and all those things and amalgams and stuff. It'd be basic restorations, basic restorative protocols, because you hygienists are mostly treating kids as well, and cleans and stuff, your perio scaling and your charting and things like that. So they have a communication area, but they have a practical area, but it's restricted to certain elements. They're not going to ask you I don't have a typical hygiene course that I can recommend, or my course are generally for the ADC students, for dentists. My course I will not recommend at this stage for hygiene students or people getting the hygiene exams. So in the future, if we look into getting a training organized for the hygiene people, sit down with some of my oral health therapists and hygiene friends, we can look into that. Um, I would really like, Karen, if you can maybe message me separately on Instagram, maybe DM me details. I would like to go through the process. What are the things included in that again? And then I will be happy to maybe guide you through on where are the areas or where are the things that you can improve, and maybe where you can actually get the content to pass the hygiene exam. So I'm happy to help you with that. Send me a detailed message on Instagram. Send me the things and the criteria for the hygiene exams, and I'm happy to guide you through that as well. Then we have, I think Karen's question was the last question. So I think we have pretty much covered all the questions. If we have any other question from anyone else, please comment below. Otherwise, I would say that, it's been good 40 minutes. So I hope it has helped some people out there. Chair positioning. So Mubashir's got a question for us. Chair position is a must, but can we bend down to check our work from time to time during the part 2? No, Mubashir, no. I have a detailed video on ergonomics and chair positioning. I have a part 1 and a part 2. I would say watch that, and that's why your dental loops are so essential. Ergonomics is a very integral part of dentistry. We've been neglected and been missed out by so many clinicians in the past, even current. I think old clinicians still don't like using loops. Everybody has a preference, and I have high respect for clinicians, but I feel like our health is our main priority. ADC people are really strict on ergonomics and chair positioning with the Australian standards, and they don't want you bending. If they are giving you 1-1 front central inside the crown prep and you're bending to do the palatal, that means you're going to fail it straight away with infection control and ergonomics, because that's what they want to test, right? That's what they want to test your skills, that can you actually do an indirect vision endo-access or not? Or are you going to sit down like this and do your work in the clinic? You have to understand ADC. After you pass ADC, you can work, get your registration, and as soon as you get your registration, generally month and a half, 2 months maximum, you can practice dentistry in Australia straight away after. So Australian exam is basically testing you to your limits, not extreme limits, but they're testing you on a certain criteria they have to judge you and say that, are you meeting the same criteria that the Australian dental graduate is meeting or not? Can you go and see a patient tomorrow in your clinic? If you feel like you cannot, that means bending is not an option. More practice is what you're looking for. And loops really helps, because with loops, when you bend, you cannot see it. That means you have to sit upright, so your vision and everything is clear. So I would say no, chair positioning is important. You cannot bend from time to time, in my personal opinion. Different teachers and clinicians and mentors teach differently, but that's what I feel. Majority of the people I know, we have similar questions about coming to Australia. Can I pass ADC exam? Is MPH the right route? I would say if you're looking for a master's, then try to find something that is in the skilled occupation list. If you cannot find it, then come for MPH, and then you will have 4 or 5 years until you can pass ADC. After you think, if you still haven't passed, you can look into extending your visa to another course. There are ways that you can always do. Till that time, apply for a dental assistant job, any other odd job that you're working on that may help you, get the work-life balance, because, financially, it really helps when you have a job. At the same time, passing the ADC exam is not difficult. It's not impossible. I would say, yes, it is difficult. Sorry, I meant to say not impossible. I guess not impossible. It is not easy. It gets very stressful at times. It gets very frustrating at times. when you're working everything and you're still not getting the result. But that's how we learn the meaning of persistence and hard work, because everyone out there who has done it, even myself, after I passed ADC, I appreciate dentistry and ADC a lot more, because when you achieve it after all that struggle, you start respecting a lot more. So it's not easy, but one thing I can guarantee, that if you work really hard, you will be able to pass the exam. So thank you for all the people who joined us today. I hope there was a helpful session. If you have any other questions, please comment below, and I can answer it now. Or if you have missed out on it, that's fine. We can possibly do another live session in 2 months, or when my next availability is. Till that time, my Instagram is Dr. Murtaza Mac. I think a lot of people already follow me there. If you don't follow, you can message me there directly with a detailed voice message or a detailed text message telling me exactly what work have you done and what help you need. Because if someone messaged me, I want to come to ADC, I just want to come to Australia, I might not reply you because I already have 100 videos. But if someone actually tells me I've done this work, this work, this work, this work, this I need guidance from, I'll be more than happy to guide you. Okay? I think there was a new question which was about, there are any relevant master's options for dentists other than MPH. Hamza, I have a detailed video on which masters to do. I would suggest please go and watch that video. I've detailed all the masters that in my opinion you can do or you should do that can help you. At the end of the day, your vision when you're picking a master should not be which masters are relevant to ADC or dentistry. Your vision should be which is in the skilled occupation list, SOL list, or the consolidated skilled occupation list, CSOL list. That means as a backup, if dentistry or BDS is not happening or the ADC is not happening, your master's is helping you achieve your permanent residency. That means it's helping you let you stay in Australia. That means, once you have the PR, that means you can stay here, give it attempt multiple times until you pass. And that's, I think, the major thing everyone struggles, because psychologically they're feeling really disbalanced with their work and life and working hard on the ADC, that I only have 2 years remaining, I have to go back if I don't pass. So that will be helpful. At the same time, I think there was one more question about any suggestions to take the masters other than MPH, as MPH is costing roughly. See, that's what you have to do your research. Most of the masters are similar. Depends on the universities as well. If you go on a regional university, they're a bit cheaper. You get extra points on the PR as well. But MPH, health administration, they all are almost similar. It depends on the university, the cost mostly. So I hope this was helpful for everyone. Take good care, stay motivated, and just work hard on it. It was not easy for me as well. It was not easy for any other person who have done the ADC in sitting here in Australia right now. So I would say work hard on it, and then you should be able to get something. Okay, I think there's a few more questions about, just a few questions just before I can't find 1,000 MCQs. Is it only available in Australia only? No, Bombasher, just search harder in the Facebook groups. You should be able to find someone, you should be able to send it. Whenever I feel like someone's saying they haven't found it, I feel like they haven't researched enough. Look at the Facebook groups, join all the Facebook Part 1 groups, and message or the post saying that you're looking for the 1,000 MCQs, you haven't found it. Someone should be able to send you. Is the current dental workforce saturated in Australia? Is there a lot of opening for entry-level dentists? See, it is never easy. Go back to my video in which I've explained about the frequently asked questions, because this question I get a lot. Tell me one dentist who passed ADC and didn't find a job. You cannot tell me one, right? That's the thing. Nothing's easy, but there's a lot available. You just need to search the right way. You just need to be persistent and just put in all the hard work. That's all you need to do. Okay? So take care, everyone. God bless you all. And I hope to see you all in the next videos. And I have a lot more useful content available for my on my YouTube channel. So you can go through my YouTube channel, and a lot of people can get a lot of benefit from a lot of videos. Okay, last question was, is there any scholarships available? There are always some scholarships available, but it really need to depends on your scores, on your percentage level and everything. So if you can apply a scholarship, you might get it. It's really difficult. I don't know. You have to check with the universities, check with the criteria, and apply. There's no harm in applying, right? You might get it, you might not get it, but there are. To answer a question, there are scholarships available for 100%. Other question was, do I need to get a master's? Is it necessary? It's not necessary. Again, go back to my frequently asked questions video. I've explained that in detail in the part 1, part 2. There's 2 videos that I posted together. I answered this in detail, that if you pick an MPH route, what are the pros and cons? If you don't pick an MPH route, what are the pros and cons? So you have, as I said, you have most of the answers already on most of the videos. So go through the videos and you might be able to get the answers that you're looking for that I might have already answered. But it's not a necessity. You can do the ADC without coming to masters. You can do ADC with masters. It really depends on everyone's comfort level, their financial capacity, at their current conditions at that point in time, that is allowing them to do a master's or pursue ADC without the master's. Okay, so God bless you all. Take care, and I'll see you all next time with maybe another useful video. Till then, you have my YouTube channel, you have my Instagram. So hope you can get more learning from my YouTube channel. Take care, everyone. God bless you.